Good afternoon. Welcome to the County Health Rankings and Roadmaps webinar on public health, special role in building partnerships. My name is Jan O'Neill, and I'm a community coach with the County Health Roadmaps Project. And my colleague, Karen Odegaard, is with me here today to assist with questions. We're pleased to be joined by Carol Moehrle, who has been the District Director for Public Health in Idaho's North Central District for the past 20 years. She's long been active in the National Association of County and City Health Officials, serving as the president from 2010 to 2011, and she's the current chair of the Idaho Association of Public Health District Directors. This webinar is being recorded and will be available later in the week, along with the handouts of the slides. The County Health Rankings and Roadmaps program is the result of the contribution of many, many partners, including the Robert Wood Johnson Foundation, our colleagues here at the University of Wisconsin Population Health Institute, and the various partners who help us compile the rankings data and get the message out about rankings and roadmaps. And we want to take a moment, as we always do at the beginning, to get you oriented to the technologies that we're using today. The GoToWebinar attendee interface is made up of two parts. On the left, you can see the viewer window, on which you'll see my screen throughout the presentation. On the right, you can see the control panel, which is where you can interact with us. We'll be taking questions via the control panel. So feel free to enter your questions in the control panel at any time, and we will answer them toward the end of the webinar. If we don't get to your question, though, during the webinar, we'll be sure to follow up with an email. So here's a quick outline of what we're going to be talking about today. We'll start with an overview of the County Health Rankings and Roadmaps program, just to get you reacquainted with our program and the site. And I want to say, just as a side note, since we have always a lot of variation in our webinar audience, from people who know just a little bit about rankings and roadmaps to those who are very, very familiar with both parts of our program, while I'm providing the overview, Karen is going to be posting links for those of you that want to explore the site in more depth. So I won't be offended. Please do feel free to pursue those links while I'm talking. And after the overview, we're going to talk with Carol Moehrle about the changing role of public health. And then we'll take some time for Carol to answer your questions. And following the Q&A, we'll show you where you can find guidance and tools on our website, with a focus on a particular tool that can help you with partnerships. Finally, we'll close and wrap up with some final thoughts. We always end with a quote, and we'll end with one today as well. So let's do a quick poll. I showed you the questions at the very beginning to see where you are with regard to partnerships in your community. I'm going to launch that poll right now and give you about a minute to answer that. Call this a rapid response poll. Thank you very much for so rapidly responding here. Great. And it's interesting to see where the folks on this webinar are with regard to either still being isolated silos or parallel play, networking, coordinating, cooperating, collaboratively planning. And we've got close to 75% of you who voted. I'll give you just 5 more seconds to finish up here. Let's get to 80%. To get there. Okay, almost there. Great, thank you so very much. Okay, I'm going to share the results, and let's take a look at that. And Karen, it looks like we've got the majority of folks are networking and sharing information, which is definitely the foundation for strong collaboration. That's very much a critical part of building those relationships.
But it's great to see that we are seeing more and more people moving into coordinating, cooperating, and then, you know, what we ultimately want to see communities getting to is that collaboratively working together to plan and implement.
Which is hard. It is really hard work. So yeah. Kudos to all of you, wherever you are on this journey. The fact that you're starting it is really something, and those of you that are already collaborating, kudos to you. That this is very hard work.
And for those of you who I would throw out there, for those of you who are collaborating, as we're going through today's webinar, if there's something that you've done that you think works really well, feel free to put that into the question field, and as we're talking, we'll try to incorporate those comments so that you can learn from each other a little bit.
That is a great idea. Thank you very much for saying that. Okay, so I'm going to close the poll, and let's move on now. So we always design our webinars around an essential sort of theme or question, and today's webinar focuses on this essential question. What's the new role of public health, and why is it so important that this new role be played today? So what we're hoping is that by the end of this webinar, you'll have some new answers, maybe some questions even, but some new questions about this particular question. So now I'm going to go into the overview, and as I said, Karen will be chatting out some links that if you're familiar with the program, feel free to go and pursue those. If you've attended our webinars before, you've probably seen this logic model, which explains why we release the rankings every year. We're now in our 4th year of releasing them nationally. And our goal, ultimately, is to create a healthier nation, county by county. The release attracts media attention, which gives community leaders an opportunity to use that attention to engage their communities in action that is going to improve health. And the bottom line about ranking is it's all about a call to action. It's really not just about the ranking. And the horizontal part of the logic model really underpins the thinking behind the rankings. And the county health rankings themselves, we rank the health of nearly every county in every state. And for every county, you'll find 2 rankings. One is on health outcomes and one's on health factors. Well, why 2 rankings? There's really 2 sets of messages that they convey. One set addresses how healthy a county currently is, so it's your today's health. And the other addresses how healthy a county might be in the future or tomorrow's health, based on the many factors that influence health. So what are those factors? The county health rankings are based on this model. This is the underpinning for the entire, all of the measures that we put together. These effective local, state, and federal policies and programs can improve a variety of factors that in turn shape the health of communities. And these health factors shape your health outcomes. So we specifically look at health behaviors, clinical care, social and economic factors in the physical environment. And we measure these 2 types of health outcomes to show how long people live, their mortality, and how healthy they feel, the morbidity. So here's an example. A clean indoor air policy is a policy that can influence health factors such as tobacco use, which in turn influences health outcomes. And roadmaps is focused on the orange part of this model, the policies and programs component. So we often point to this image as one of our most important because it outlines what we use to determine county health rankings and what influences health in the community, which is obviously way more than what happens in the doctor's office. When you go to our site, on the home page, you'll see a map where you can click on your state, and from there, you can go to your county to find out how you rank this year, and you can actually look at the past 3 years as well. And I'll mention that we also have archived webinars that show you how to go in and make sense of the measures that we use on our county health ranking. And going back to the logic model, the roadmaps project fulfills the vertical section of the model. So now that you have your community attention, you want to find the best possible strategies, ones that have some evidence of effectiveness, to focus on your community's health priorities. And ultimately, by taking this collective action, using these effective policies and programs, over time, people in your community will be living longer and higher quality lives. So this is a model that explains the why and the what behind county health rankings and roadmaps, but how do we do this? That's where the take action cycle comes in. It's the how within the county health roadmap. It's a simple and straightforward process that communities can follow to improve health. And many people are using other processes like MAP and so forth, and those fit just beautifully and align with this process as well. Basically, and I'll take you to our site later in our webinar, you'll see where there are a lot of links to tools and guidance for each of the steps in this cycle. And at the core of the cycle, you can see people working together because we know solving issues like poor high school graduation rates, which is a socioeconomic issue, excessive drinking or inadequate health care really require the wisdom and resources of the people from all walks of life in our community. So the basic notion here is gather some information, but don't get stuck on the right side of the cycle. Gather that information, set priorities, and then find the most effective approaches to address those priorities, and then, of course, go and do it. And, of course, evaluating throughout the cycle to help you improve your strategy and ensure that what you're doing is effective. You'll also see that communicate sits in the center of the cycle. That's because communication with stakeholders is essential throughout the Take Action cycle, and we have guidance for that as well. So that's a quick thumbnail sketch and an overview of county health rankings and roadmaps. As I said, we'll go back to the Take Action Center after we've had some time with Carol. So without further ado, I'd like to introduce, and as I mentioned, Carol is the former president of NACCHO, and she also serves as the chair of the Public Health Accreditation Board, on board of the National Counties NACCO, where she's the chair of NACCO's Public Health and Health Community Subcommittee. And somehow she finds time for a life and all of that, because I know, Carol, that you do a great job of balancing as well. Now, you've been in public health a long time, and you're really passionate about it. Can you just talk with us a little bit about what keeps you so committed to the profession? And welcome, by the way, to the webinar.
Thank you, Jan, and welcome to everyone else out there listening. Thanks for joining today. We hope that we'll answer some of your questions or at least start some of the dialogue. I have been in public health a long time, and I think without passion you don't survive in this ever-changing world. But part of my core is truly balanced in our public health mission and our vision for healthy people in healthy communities. It takes a long time to move that needle. So while I'm still moving the needle and having fun, I think it's still an appropriate career path. But more importantly, I love to orient new staff and new partners to public health. I love to feed that enthusiasm and to watch when they finally get it. And I know all of you out here have seen your staff or your partners when that light bulb finally goes on and they get what public health is, when they figure it out, and that they finally realize how they can help influence the health of others in the community. That enthusiasm to me is just so contagious, and that's what keeps me bringing back to that public health plate every day. I love it.
That's so great, Carol. You're such a natural teacher and leader. Thank you so much for introducing yourself that way. Can you tell us a little bit about Idaho's public health structure before we launch into talking about the changing role, please?
I would love to. And for those of you that don't know Idaho, or maybe those of you that are a little geographically challenged, this is our state. We are snuggled between the state of Washington and Montana and Arizona and Nevada and the Canadian border and little Wyoming. So we touch and border lots of others of you. Our structure in Idaho, our public health local structure, is a regional or district system. So what you see here in the colors are the 7 districts, local public health districts in Idaho. Where you see PhD 2 in that orange color, those are the 5 counties that I am oversighting in the job that I do as the director for a districting public health system. We are all local, we are independent, we are autonomous, and the 7 of us cover all 44 counties in our state. So when we meet together to work on issues, and I'll explain that a little bit later, we do them together. There's only 7 local health officials that sit at the same table together, and oftentimes with our State Department of Health. So we are fortunate in our structure that we have. We think that it's, for a small rural state, it's so efficient for us. So here's another, just some bullets on what we do in Idaho. Like I said, there's 7 of us. We sit at one table. We write a strategic plan statewide, a local health department strategic plan together. We're working on accreditation preparations together. We were the first state to do public health ready as a state system, all 7 of us together. We, of course, are doing regional response like many of you are as well in our 7 regions. We are managed by local boards of health that are policy-making boards, and they set the agenda and our budgets for how we move forward. So there's a lot of interactive group work done in Idaho because of the way our structure lends us.
Thank you, Carol. That's helpful to sort of set the table of what your world is like. And so let's move into the meat of the webinar. Could you talk with us a little bit about, from your view, and you've been in public health a long time, how has the role changed, and what does that new role look like, and why is it so important that this new role be played today?
Thanks, Jan. So we all know, all of you on this call, that we've had some fiscal challenges over the last few years. We know that it's been incredibly difficult in our public health system to make sure that we are continuing to move ahead with what we need to do. But the situation that we're in really affords us the opportunity to develop some efficiencies. And with those public health efficiencies, part of that is developing a stronger commitment to working with our partners. And in order to address some of the leading causes of illness and death in our communities that we all live in, we have had to strengthen our existing relationships in order to reach out to some of those non-traditional partners, as well as the ones we always think about. So in addition, we are taking on new challenges. We can't forget that we need to look at new ways to better define the role and the purpose of governmental public health. Just saying that we've always looked this way isn't good enough. We don't have enough human resources or fiscal resources to maintain the old world. So what we're finding out across our country, in Idaho in particular, that it's taking all of us working together and bringing all of the partners we can to the table to make a positive impact on those health outcomes. So when you look at what's going on to our public health system across the country, we can either say, oh boy, we have a threat, or we have an opportunity. And of course, I would always rather look at that sunny side of the issue. But public health has always been the captain of our own ship. We always have embraced prevention, and we are really good at what we do. It's been a niche of ours in our communities for generations that public health leads that preventive world and is looked at as the leaders of what we do. But any longer, we can't do it alone. We kind of have run out of our resources to do it all by ourselves. And in fact, with the changes in the funding and our decreased staffing, it's not only necessary now, but it's sometimes the best practice if we hand over some of that control to others, and then we in public health let them set the direction and help guide that direction that others might be setting as they are now captaining the preventive ship. So when we look at opportunities in public health, we know that in order to improve the health of our communities, we can't do it alone. That's pretty obvious. We also must work together across many sectors. So we know for sure, and why we have such credibility in what we do, public health is a neutral, respected, knowledgeable convener. We have a special role to play when it comes to bringing our partners together. We also know that we need to be more flexible in how we partner with some of our community members. We've been pretty rigid in the past in lots of areas. We've built silos. We've said this is ours, it's not theirs, don't come into our realm. We need to open up a little and be a little more flexible in order that we can invite others and they want to be invited to the table to work with us. And then we also need to ask ourselves, what can we do to leverage or improve the population's health? This could be somewhat of a paradigm shift for some of the health departments out there who are used to doing it all on their own. But once we determine and figure out that we can leverage what else is going on, it's so much easier to get the job done using partners at our side.
So Carol, this new role as convener, and this actually came up in a lot of the pre-registration questions. This is the folks, all of our questions. How can public health in this new role engage diverse partners and community leaders in health improvement activities? What does that look like? Could you talk about that?
I would love to. So when we look at public health and partners, I really like the graphics, so that's what you're looking at now. Since public health is that natural convener, we have the opportunity to bring those partners and leaders together to address our mutual issues. So let's talk about partners, and we'll flip the slide now. We have traditional partners, those that all of us have used for generations, over and over. Our elected officials, our peers across the state, our boards of health, our education systems that seem to be linked really tightly with public health and should be, some work sites, some businesses, sometimes our medical community. But I really beg you to think outside the traditional, to the new and unusual partners that might be out there for us to work with. So when you look at this graphic, consider this web of partners. But first let's talk about a spider web in general. A spider web is said to be one of the strongest materials known. It's not simply the material's exceptional strength that makes it that so resilient, but it's the unusual strength and stretchiness, or the flexibility, that gives it, that spider web really a flaw-tolerant system. So if we look at public health in that spider web of resilient system, we see partners from all different avenues on this chart. When we talk about the partners, they are endless, and this chart could be as huge as you can make it in your own areas. But I believe that the only way for public health to survive is if we thrive on these partner relationships. They are all interwoven in some nature. Many of them are working together in their own little clusters, but maybe haven't brought public health into their cluster. Many of them are driven by public health, and we bring them into our clusters. But at some point, when you look at the intersect between them, we are all connected in some way. Public health does not for a minute presume that government can do all of what we need to on our own. We've got to tap the best leaders in the larger community, those that have something to offer to bring to the table to help public health work on our issues. We need to include government, business, faith communities, all of those that you see here and many more. We oftentimes look at our schools of public health, or maybe we forget some of the research departments that are doing research on other things than the core preventive public health services. We need to make sure that our behavioral health, mental health is on this. We're looking at those areas where public health can work together with those. And when you look at this, many of you are state health department systems or a mix of state and local systems. Those are some of our strongest partners as well when you look at other public health partners. So we must not forget that we need our academics, the other healthcare entities, and the news media. The media can be one of our strongest partners when we're looking at how to get our messages apart. But the new public health, we need to break out of our old silos and work with others in collaboration. We do this in preparedness, in prevention, in chronic disease work. We do it with our work in social inequities, environmental and economic disparities. All of those need partners in order to get and fulfill the role that public health needs to play. So I love this graphic as it displays public health partners, and it shows to me that together we're very strong, just like that spider web that it displays. And we have the strength together as we stretch and grow and ebb and flow, and it's this interconnected web fashion that we can positively impact the health of our population if we are all in this web together.
Carol, can you give us some examples of these new types of partnerships of how people work within a web like this?
I can give you some examples from Idaho, and I'd love to share just a few. And then I have a little bit of information from NACCHO as well. So in Idaho, we've looked at some of our standard traditional partners as well. We have several tobacco-free alliance coalitions, some of them being managed and run by our medical association or our hospital association, and public health being a partner, but not the leader of our tobacco-free alliance in Idaho. We have brought to their table, the medical table, some of our traditional partners like the cities and the parks departments and our planning departments, students that maybe our medical society or our hospital association has not thought of. So together we have strengthened that alliance to do some of our best tobacco work around policy as it relates to smoke-free parks and smoke-free child care centers and the good smoke-free work that all of you are doing as well. We have a collaboration with our hospitals in Idaho. In fact, the 10 northern counties in the state, have two local health departments, districts that are in those 10 northern counties. Those 10 hospitals had never been in the same room together because of their competitive nature. So being the natural, neutral convener, the two health districts in northern Idaho that represent those 10 counties put out a request to the hospitals to meet together and for us to convene that meeting on neutral ground with the primary purpose of course, talking about the community health assessments that the hospitals are required to do for their 990 requirements. Public Health in Idaho working on accreditation and having done community health assessments for many, many years as we look at improvement plans, have a new partner in this. We could bring data to the table, and these hospitals were truly amazed that we could help them solve their issue as well. So not new partners, but a new impetus to bring them to the table and to be neutral in what they were doing, not competitive like they typically are. One of my favorite groups that we have in our district is our Regional Solid Waste Advisory Group. They're an advisory group, but they are the recyclers, the landfill owners, the county commissioners. It seems like everyone loves to talk garbage in our area. And so we have a room full when we pull together a Regional Solid Waste Advisory Committee. We are still the conveners of this group. This used to be a public health work group, is now a regional entity of their own. The county commissioners kind of spearhead this one as one of the natural leaders in the relationship, and they work on common issues. They work on territorial issues where they're fighting and arguing each other and whose turf you're in. They also work on legislation and rulemaking and issues that affect our built environment in our area. So when you think of partners, they're not always health related, but these garbage guys are awesome partners for public health. And then typically, many of you I know have diabetes contracts or coalitions that you work with. We have that as well. There's some of our great partners where we've had a medical group step forward, and these doctors are offering free eye exams, foot exams, in order for us to get a handle on the large growing diabetic population that we have. So in a partnership, in a coalition, that partnership of local leaders, the physicians group stepped forward on that one to help solve some of the problems and address some of the issues. And then finally, we have a regional healthcare network. This started with our preparedness funds, and we started a coalition again. It has the county emergency managers and first responders in our EMS system and our hospitals and our coroners. Public Health started this, and then they, after a few meetings, well, quite a few meetings actually, and a little nudging, have developed their own network, and they are running on their own now. Public Health sits at their table. We oftentimes take notes for their table and minutes, but they are an entity that was started under Public Health, but we have now been able to turn over to someone else to help do that workload. So as you can see from many of these examples in Idaho, Public Health has started them. Oftentimes with the partners, it takes Public Health continued to be at the table to continue to give them energy and keep them maybe in a focused direction, but it is possible for them to engage and take over the ownership of some of those coalitions and the work going on in our communities, which is really exciting. So let me divert from Idaho for just a second. NACCHO has done an assessment of local health departments that engage in cancer coordination coalitions. And what they found when they did their assessment of those that are really doing successful work in cancer coordination, cancer coalitions, excuse me, is that 87% of those coalitions are healthcare provider driven. 66% of them pull in some religion and community organizations, and only 32% of them have academic institutions that sit at those tables. So I think it gave me an aha that no matter where we are in our coalition activities, we should probably make sure academic is at all of them. They've got the students, they've got resources, they've got expertise, they've got hands that we can use for other things. So we're going to be sharing with you that website for you to also look at this NACCHO assessment that was done on cancer coalitions and the outcomes of that assessment. So that's good information if you're wanting to see more.
Yeah, that's great. Actually, Karen just put that in the chat window there so people can go and take a look at that. Really, it's a great sort of case overview of what that would look like to bring that all together. It really is very helpful. Thank you for that, that link. Carol, as you were talking along here, and I think we all heard the role being played out as no more just the doers. In fact, what you're doing is convening and helping facilitate these conversations, and then in that process, launching people's initiatives. And as you said, staying there by their side, but you aren't the main attraction. You're not the one that's designing all the agendas, doing all the minutes, You're really turning that work over to them. And in your conversation, you were talking about some of the policies that have been worked on. Tobacco is one example, some built environment stuff. Can you talk a little bit more about how public health in this convening role can spur communities to do policy work?
I'd love to. So, policy work is tough. It's much easier. Some coalitions, when you get them together, and I'm sure all of you out there know, the coalition that wants to have a health fair. They want to have a health fair. And sometimes that's good to get the message out, but it doesn't change a whole lot of our outcome in our communities. Anytime we can get groups to focus on policy and environmental change, there is so much more bang for the buck in the carry-on, in the consistent messaging and the future that we have. But in order to sustain the public partners, those efforts are a little bit different. The policy work takes a lot of influence. It takes people willing to go to bat to testify at a community or a city council meeting or a county commissioner public hearing on an ordinance. There are people out there that love to do that, but they are different than the ones that want to just have a health fair or a booth somewhere. But when we can implement a policy, it really is a systemic change in our community or our environment. It also, they go on for a longer period of time. They can level the playing field with members in the community. You can get a lot of wording in a policy, make it flexible enough to fit any community, but yet that policy stands and is easier to implement and make change sometimes. So I always encourage, when we're working with community groups, is there a policy we can work on? Is there something they can hang their hat on and have their name attached to a positive public health policy in the future? We just had a group in Idaho, in my 5 counties in fact, one of our communities that has used fluoride in the water for decades. And the city council decided that maybe fluoride was poison in this round of elected officials. And we had a community coalition come together, led by some dentists and some parents, and they went to bat for fluoride, and they got a new policy passed in city, through the city council that said there would always be fluoride in this water. They did it. Public health was in the audience. We gave them talking points. We gave them strategy points. But they're the ones who influenced and carried that policy work. So that will be on the books for now, and not something we have to continue to address every year as such in these coalitions. They can focus on something else. So the policy and the environmental change are such huge success stories when a coalition can work on those.
And I think you mentioned this a bit, but what is the role of public health in sustaining efforts?
Well, you know, part of our role, I think, is to be the cheerleader. But we also know that the factors that you see here, those are things that enable a coalition to achieve their objectives. These factors, again, come from that NACCHO study where they queried the informants of the coalitions and said, you know, what would you recommend? What keeps coalitions successful? So these are these aren't Carol made up bullets. These actually came from the NACCHO assessment that was done. So when they asked the stakeholders of coalitions what helps them be successful, they said they want to be engaged. So if a coalition possesses some kind of a core team and they can set some mutual goals, those stakeholders and volunteers are much more likely to be successful if they have if they have some kind of a team that's already established, even with volunteers. They also said that their visibility is important to them. They like to know that they have a name recognition, for instance. So our solid waste group, they're known as the RSWAC committee. And RSWAC is known across our 5 counties as the Regional Solid Waste Advisory Committee. But that gives them visibility when their name is in the paper. So these coalitions are saying that helps them be successful. Also when they have the capacity. Sometimes capacity is identified as some funding. Sometimes it's just some support staff to help them with taking notes and documenting and maybe writing press releases and some of that little more technical work to do advertising. But having a little bit of capacity helps those coalitions be more successful. As does, which I was, we all have different varying relationships with strategic planning, but the coalitions that were surveyed said that when they have something written, some goals attached to some strategic directions, they are more successful. So I think that's important as we look at our coalitions that we run. Do we actually sit down with them and talk about where they want to be? Do we set mutual goals? Do we actually have some time-limited, measurable outcomes for them? I think they're more successful when public health helps them do that. And then the coalitions that were surveyed also said that data, especially if it's local data, is sometimes central to what they see as what they can work on. So if they can see the data and help move the bar on the data, they feel like they can be more successful as a coalition. They also reported that somehow they need a leader. They need some kind of a leader to keep them organized and inspired and to mobilize new members. They did not say the leader has to be from public health. They just said someone with passion to be to help convene and lead the group through their normal meetings. So I think that is another role for public health, how we can help them identify those true natural community leaders with the passion that might help those coalitions move forward. And then they also said one of their successes in coalitions and in sustaining coalitions is that we cross-pollinate. And we cross coalition collaboration. So in our small state of Idaho, it's hard to find people. We're very rural and we see the same faces at lots of meetings. So we started combining many of our coalitions together. If we have a cancer coalition and a diabetes coalition and a fitness coalition, they're all working on a lot of the same things. So when they meet together, they just compound each other. There's more people in the room. They're working on the same outcomes and goals. There's more energy. So anytime you can cross-pollinate or collapse and combine coalitions, I think there's sometimes a better success in maintaining the energy and the work that they have to do. But I'd like to go back to data for just 1 second. In Idaho, again, and I'm just touching on this, we all use the county health rankings. And because it brings us local data that many times we are not blessed to have of our own. So the county health rankings brings us that in our county structure. We also work with the Network of Care for Public Health to show our Healthy People 2020 indicators and any of our local county indicators that we have on a dashboard like this, so that we show this to all of our coalitions, all of our partners. It's open access to all of our public. When they can see data, data is so powerful for coalition work in helping to say, whoa, that red diabetes mark, that redder area that shows the county health rankings information and our Healthy People 2020 data, we've got an issue there because it's red. So I just wanted to share how we kind of share the data in Idaho. And then the next slide also, we're able to then show it across the 44 counties because we are a regional cooperative state system. We can see where others are doing better, so we can ask the questions across the state, well, how come your county is doing better than ours? And again, our county health rankings data has so much helped us to get the message out to our elected officials and our coalitions that they can be building on how to make strategies to approach some of these gaps that we have in the health of our citizens. So that's all I needed to share you what Idaho is doing on some of our data.
That's very helpful. The specific really helps us understand. We're getting close to where we want to let the audience ask you some questions. We do have some questions being asked, but just to sort of wrap this up, can you talk a little bit about how public health can help build capacity without overburdening the same people? Now, you did talk about that a bit in terms of cross-coalition work. Do you want to say a few more words about that?
I would just say one other word. This next slide that you'll see, burnout happens. And we did talk about those bullets. I'm not going over those. But prevention is everywhere in public health, even in coalition building and maintenance. So it is oftentimes our job in order to help prevent the burnout that these people have, and using those strategies above, or those barriers that we have. If we know the barriers going in, it's sometimes easier to eliminate the burnout. So also just again, if we're looking at how we can best impact this, anytime you can build a policy or develop a policy, we get a bigger bang for the buck. The next bullet, anytime the partners come and go, anytime we can use our energy and our passion with those members and sit at the table together, working together, we have a better outcome as well. Again, strategic planning is important. They need a goal, they need something measurable to keep them moving forward. That's the next bullet. And then the last bullet on this page, I think, is measuring our community's performance and adjusting our goals. It's necessary. Sometimes we get a little off track. Sometimes those coalitions move down a road. It's public health's role, again, to pull them back in order to make sure that they're heading down the right pathway, and they're in tune to the other efforts that are going on in our state. And then finally, let me close with this. Just like this flower, it's determined to bloom even in the most difficult of situations. Local public health will survive and flourish as, together with our partners, we focus on improving the health of all the people. Public health, we are the natural and respected leader, convener, and we're very resilient in what we do. The timing is now for us to embrace this new role in public health, and the opportunity we have in working with our partners to bring this improvement to the health of our community is very, very strong. So go out, embrace those partners, and get something new going.
Carol, thank you so very much. This has been a very powerful interview with you. And now what we want to do is open it up to questions from our audience. So I'll turn it over to Karen.
Thanks, Jan. We do have a question here. I'm kind of summarizing a couple of questions that folks asked, but Carol, you encouraged us to think about the new and unusual when it comes to partners. How can public health effectively reach out to those non-traditional partners? How do we sell the value of health improvement work to diverse partners?
You know, a lot of it, I think, is word of mouth. A lot of it can be who we know and who we value and trust. It used to be my philosophy. It was always my job to figure out who those partners were, or maybe my manager's job. Anymore, I go to my line staff and say, who do you know in the community? Everybody knows something. Everybody has neighbors. Everyone goes to a different church. And every single staff person, every Board of Health member knows someone who maybe is influential enough and wants to volunteer and be on a coalition. So I have reached out way into my organization, and that's just become a part of everyone's job as such when they come into my office and say, did you think about this person? Because I know this person and I can make that telephone call.
Great, that's really helpful. And I know Jan's going to walk through the website a little bit in a minute, but we do have some tools there that can also help you think about how you engage other partners. Somebody here is asking about strategies for local health departments to kind of keep in the know about policy developments and how they can engage the community in seeking policy change. So how do you, I think they're getting the message that policy that they need to be working on policy, but how do they make sure that they're working on the right policies and keep their community engaged there, Carol?
Policy work is difficult, but I think we don't need to reinvent the wheel on much of it. There's the Public Health Law website has great resources for us that already have done a scan of all of the states and their laws that are on the books, their rules and regulations around public health. NACCHO has some great resources there as well on policy statements. I can't tell you the number of times I've used a NACCHO resolution to develop a resolution for my Board of Health or my city council members. We don't have to start over, so look for resources out there and we can help point to some of those as well, to use others that have already developed those policies and tweak them for your local area rather than trying to start fresh.
Carol, I'm going to jump in here too and just mention the What Works database, which is in our Action Center. So folks can go in, they can just actually click on that link for What Works for Health, and we'll see close to 200 strategies that we've vetted over the last decade or more, and we keep adding more. So that's another resource as well.
That is a great resource. Yes, thank you, Jan.
Is there time for one more question?
Great. We have, I know, some folks on the call who are not in public health. How can they connect with their local public health if they haven't been reached out to? If they're United Way or if they're a nonprofit, some other nonprofit in the community, and they haven't had public health coming to them to try and convene them, how do they approach public health?
Oh, and if you are one of those people, please reach out. I love a call from someone new in our community that says, I don't know anything about you, but could you maybe tell me what's going on and maybe help us? That's all it takes, either an email link on the public health website, a phone call to a staff person or the director at the health department. That's one of our core jobs, is to interact and relate back to our communities. And we hate to think that we miss people out there, but that happens. Once in a while there's an organization or a group that we have forgotten about or overlooked for some odd reason. Please reach out to public health. Even if you don't know what we do, even if you don't know if we can help, it's all about those partnerships and how we can work together with each other to lighten the burden of the work that we're all doing.
We do have one last question here, and you talked about a little bit the challenge of fiscal constraints, and somebody here is saying, Marjorie is asking about the fact that they're losing leaders and public health professionals because of budget cuts, and so they're losing the folks that have that experience in their public health department. How do they overcome those challenges and still play this important role?
You know, we are having some of that too, and it is so difficult for the staff that have mentored and brought along a coalition and then no longer, you know, having to turn it over, first of all, to the public to run itself. I think that that's our reality anymore, however, and I think that the more we can engage those coalitions to become their own natural leaders and have maybe some of them not even having public health at the table, but knowing that there's a public health agenda being moved forward by another group. It's kind of like how we've steered our boat ship for so long and now someone else is coming in. Sometimes it doesn't feel good. Sometimes it doesn't resonate with what public health has done for generations. But I do think that using our partners and trusting that they will carry on some of that good work that we've helped them start is truly a role that we're going to have to accept. It doesn't feel good always, but I think that's our new paradigm.
And I'll just mention, this is Jan, a model that Central Michigan, Together We Can, is using, where they are scheduling regular leadership capacity building workshops for people in those communities across the 6-county area. So they're creating facilitator guides on how to run more effective meetings, how to facilitate difficult conversations, how to prioritize, how to do advocacy work. It's just a tremendous capacity building model. So I'd like to throw that out as another role for public health as well, and that's being led by public health.
Oh, that's a great tool, Jan, and one that we all could be using to gear up. We should be doing those things even if we're not looking at tight fiscal constraints.
So we've got more questions also, Carol, and what we'll do is take these offline for you, and you've very graciously said that you could answer these offline via email. And we'll just say for others of you that haven't had a chance to have your question answered, we will get back to you via email as well. So thank you very much. What I'd like to do at this point, and Carol, you've just been fabulous, so I hope you can hang on for a little bit here. We are going to go over to the Action Center, to the roadmap site, and I just wanted to share with folks how to get to a tool that you and I had looked at, and you said, yeah, this is a good tool to be sharing with folks, and it's in our Action Center. So if you go to the Roadmaps to Health side of our site, and if you click on the action, well, you can click on the Take Action wheel, and you can click on Public Health. And if you go to Public Health, you'll find this tool that we will be talking, or that we will encourage you to go take a look at, especially if you're a public health professional and advocate, but others can get some great benefit out of this as well. This is from the sort of IAMA section of the Take Action Center. And if you scroll down under Key Activities, you'll find the tool that I'm going to be talking about, and it's in the Act on What's Important section, and it's called Healthy Community Design. When you click on that, you'll see the link to that website. So I'm going to click on that actual website, and that's what it looks like. And so it's a little bit buried in how to get to it, but I wanted to show people how to get to that tool. And again, here's what it looks like in the slide format. And this tool is a website from NACCHO, and it includes tools to help public health practitioners learn about or further their work on the connection between public health and particularly the built environment. So this is just one of many tools that we have in the IAMA section of public health. But I think you could see as I went into the Take Action cycle, you can go into any one of those sectors. So say you come from education or if you come from healthcare, and you can find other tools for your particular profession. That's another way to go in and find tools. I also want to mention the webinar series that we have coming up. And we've actually got 3 different series. One is the Breaking Down the Rankings Model series. And so if you're not a member on our e-newsletter, you can begin subscribing to that, and you will hear about these Breaking Down the Rankings Model, what we're going to be doing in each of those. And we did kick that off on April 23rd with a look at tobacco and alcohol use. And you can go and see the archives at that link that we show here. We also have this partnership series, of which Carol has graciously been a part of, and we are going to be having a webinar focusing on partnering with healthcare later in July, and we will be having another one in September for sure with the VP of Target Corporation, talking about Carol McNulty, talking about what they do to partner with communities. So stay tuned for those partnership series. And we also interviewed a community policing health department in Flint, Genesee in Michigan, and that's archived. So that was the last partnership webinar. And then we are also presenting the Take Action series again. And there's some great webinars coming up on each of the steps in the action cycle. So you can go and find what the next one is that's coming up. And I believe it's Fulton County, Georgia, and they're doing some fantastic things with focusing on some key priorities and working with their communities. So there's lots that's available, and they are all archived. So in wrapping up, today's webinar focused on this essential question, and we hope that you're walking away with some answers to this, as well as perhaps some new questions that you have. If you have those questions, please feel free to contact us, because thanks to the support of the Robert Wood Johnson Foundation, we now have 3 community coaches in the County Health Rankings and Roadmaps program, and our assistance comes to you at no cost. So don't hesitate to email or call us. We're here to help. And that would be Karen, Kate, and myself. Here's how you can stay connected, and we invite you to follow our blog on countyhealthrankings.org or on Twitter, to like us on Facebook, and to subscribe to our e-newsletter. So I'll just end with this quote. This image, Carol talked about opportunity and challenge, and this seems to sort of capture it, that change always brings an opportunity. It's an opportunity for growth, and Carol, I think you are the epitome of taking on any new challenge as an opportunity for growth and an opportunity to do something differently, do something better, and do something that will benefit all the people that you serve so well. So I want to thank you again so much for being on our webinar today on Partnering for Public Health, and we so very much appreciate you.
It was fun. Thank you.
So we will close the webinar momentarily.